Hey guys, and welcome back to the channel. And for those who have just stumbled upon it, appreciate you stopping by and checking us out. Hey, as some of you might know, this is the first time that I'm back on my motorcycle in a few weeks. I had a medical scare a few weeks ago that took me off the bike, and I've talked to a couple of you guys already, in messages and stuff about it, but I haven't made a vlog or anything about it, and this is the first time that I'm doing that. And I made a video a while back about get busy living or get busy dying. Well, apparently I was getting busy dying and just didn't know it. I'll tell you what happened though here. A few weeks ago, it was about in the middle of the night, I had a pain in my abdomen. How guys get up and have to use the bathroom early in the morning or in the middle of the night, and I got up and I couldn't use the bathroom at all. Nothing. I couldn't do anything. I couldn't urinate. Scared me. And so I decided, I said, hey, I'll go back to bed. Maybe I'll sleep it off and wake up the next morning, and maybe I'll be able to use the bathroom. Well, sure enough, I finally drifted back off to sleep. Woke up the next morning, went to the bathroom like, every man does. And I couldn't use the bathroom still. And that got me worried even more. But, I said, well, okay. All right, let me jump in the shower. I'll take me a nice warm shower. And once I got in the shower and that warm water run over my abdomen, then, I was able to, use the bathroom just some. And that was a relief. And so I told my wife about it, and so that the next morning, that morning, I called my doctor to see when I can get in. Of course, I'm gonna tell you, getting into a doctor for getting things done is hard. Even he said, you have to go to the emergency room, and hopefully I wouldn't have to go to the emergency room. But anyway, he did a telehealth with me later on that afternoon, and asked me to describe all the symptoms that I was going through and everything. And he come to the conclusion that I needed some medicine that would help from what I told him and what everything sounded like. So I did. Got the medicine that afternoon before we went home. And he also said, well, it's getting close to the weekend. He said, if you still have problems, you need to go to the emergency room as fast as possible. And lo and behold, the weekend got here, and I started feeling a whole lot better. Still having a little trouble, using the bathroom. And as the weekend rolled on, it got a little bit better after I took the medicine, and a little bit better. And by Monday, I was feeling, I'm going to say 60% better, was urinating a lot better, and was still taking the medicine. And luckily, it didn't get so bad that I had to go to the emergency room, because he said if I had to go to the emergency room, then I was going to have a lot of trouble there, and they was going to have to use a catheter in me to get the urine out, because you didn't want that to back up in your system at all, because you was looking at death if that happens. Luckily, it did not happen. But I ought to tell you guys, a lot of us men think that we are invincible. A lot of us don't go to the doctor like we should. We put it off until the last minute, and sometimes the last minute is the last minute. Trust me. And I'm kind of reluctant, to talk about this because a lot of us men don't like talking about our medical problems that we're having. I don't know. I don't know if it's just our manhood, or we're too scared, or we're embarrassed about it. And I'm just a little embarrassed now, but I see the importance of talking about this. And I never really thought about prostate cancer or prostate health or none of that until I had this episode. And I just want to tell you guys, if you're having a little bit of trouble and some signs, you need to get it checked out as fast as possible. Of course, now I still got a visit to my doctor. I haven't had a chance to get in to physically see him yet, but I'm on the calendar for the visit. I don't think I got prostate cancer. He doesn't think I got prostate cancer because I've had blood tests and screenings before that did not detect that. But you never know. So I talked with on another forum with some of my business forum with some of the guys on there, and we were talking about it. And one of the guys on there was talking about his brother-in-law. He said the guy is very, very personal about his health and doesn't like to let anybody know if he's sick or not. Now he's in pretty bad shape. I think it's cancer. I don't know if it's lung cancer or what kind of cancer or whatever. But he was a very, very private guy about his health and didn't like for a lot of people to know about it. Another one of my colleagues was telling me, about a year ago, he had a scare just out of the blue. He had a slight heart attack. And he said it was misdiagnosed a couple of times. But, hey, guys, you got to get your health taken care of. Brings me to another question also about this. How old is it? How old can you be to ride a motorcycle? Well, I wanted to say, as long as you can throw a leg around it, you can ride, but you can be very young and not able to ride your motorcycle if you don't take care of your health. You got to look out for your health, guys. I'm hard-headed. I don't look out for my health like I should. I know I should. I don't visit my doctor as much as I should because now I do suffer from high blood pressure. I had an episode with my blood pressure maybe a couple of years ago. I woke up one night with a bad nosebleed and it would not stop bleeding. And I had to go into the doctor, and as soon as I got there, they rushed me to the emergency room. I had a blood vessel that had busted in my nostrils up in there, somewhere up in there that they had to fix. And the doctor was telling me after, a few days later that it was good that blood vessel busted because if it hadn't, you might have had a brain aneurysm or something from the pressure of that blood vessel. And he said it was due to high blood pressure. Well, I didn't know I had high blood pressure, but apparently I did. So now I take medicine for my high blood pressure. And a lot of it's due to stress, bad eating habits, and I know that. And I used to eat a lot of salt. I'm not gonna lie, guys. Every time I touched a meal, I was putting salt on it before I even tasted it because I'm a saltaholic. But now my salt intake is no more. So that was my first scare. So I don't know which one was more eye-opening, the blood vessel in my nose or the prostate, because both of them can kill you. But the subject of the prostate is something that I know a lot of us men just really, really don't like to talk about. I know they have screenings and all that. prostate check, go see a urologist. And living in Alabama, my doctor was telling me about, seeing a urologist, but they are so backed up, and you have to get a recommendation from your doctor or referral from your doctor to see them. And there was a guy at the same time I was there, on the teleconference he was telling me, that was going through the same thing, but he actually had prostate cancer. And he was trying to see a urologist, and he couldn't find anyone at the time to get him in as quick as he wanted him to. So they've like backed up a month. So my urologist is backed up to December the 18th. That's a long time, guys. And it had me real scared, because I'm thinking, am I going to have to go through months and months of not being able to urinate? But luckily, the pills that I had cleared mine up, and I think I just had an infection. That's what we are thinking until I get in to really get another blood test to really check it out. But yeah, that's what's been going on with me. So that's why I haven't posted any videos. And like I said at the top of this video, that this is the first time I've actually been out on the bike, me and my wife, because I'm feeling, I want to say I'm feeling 100%, but we never know. I had a friend of mine, which I'm going to get off subject a little bit, but it's still about health. But we were talking, and he was talking about his brother. He said his brother was out in the driveway working on his car, and his wife was looking through the window at him, and he stood up, pulled his cap off and wiped his brow, and fell straight back. He died right there. He had a heart attack and died right there in his driveway as his wife watched him fall. That fast. So you never know about health, how unhealthy we are, unless you get yourself checked. And that brings me to another thing about healthcare in the United States. A lot of reasons a lot of us don't go get ourselves checked is because of insurance. We have health insurance, but it ain't the greatest health insurance because it costs so dadgum much. And a visit to the hospital, emergency room, or a small procedure can almost bankrupt you in the United States. And that is horrible to say. That a procedure could cost you $50, $60, $70, $80 to $100,000 or $150,000 for a couple of day visit at the hospital. That's bad, real bad. And I think we are the only country, just about it, that healthcare system is really good but bad at the same time. I got a colleague that lives over in Canada that says they have a single pay system in Canada. If you're working, paying taxes, you get a government insurance card, and you're able to go to any hospital or doctor that you want because you got the single payer. I think that's great. Some of you might not agree with it, but I think it would be great. If you are a working citizen of the United States, you paying taxes, I like that single payer system. We know our healthcare system is broken. We know our pharmaceuticals are skyrocketing. That reminds me of another friend of mine. His wife had cancer, and the medicine was extremely high. Extremely high. But luckily he had a friend that lived in Canada that got him the exact same medicine for so much cheaper, that it was affordable for them than it would be here. But guys, hey, if you're stubborn like me and you don't like to check on your health, you better start checking on your health. You could be riding your motorcycle and fall over dead. And none of us want that to happen, because you're leaving behind a lot of good people. You're leaving your wife, your kids, and all kinds of family people. So hey, get your health checked. And I know I'm gonna get my health checked. And make sure you're all right. I know sometimes doctors miss this and they miss that. Hey, you gotta get it done, guys. So I'm going to end this video on this. Maybe I got everything in that I wanted to say about prostate, getting that checked and all that good stuff, and why I hadn't been on. But I'm going to say it one more time. Guys, get yourself checked out. Try to get your regular doctor visits. If you only go once or twice a year, get it done. Hey, I appreciate you for looking at the video. Like I always say, like, comment, and subscribe. And we'll see you next time.